Good afternoon, good morning, good evening, depending on where you are tuning in from. Welcome to our program today, which is the Wisconsin Idea Spotlight, What You Don't Know About Exercise. My name is Rena Vacone, and I am an alumni of the University of Wisconsin-Madison. I'm also the founder and CEO of a health, wellness, and fitness company called Passion Fit, which I launched about 7 years ago after a long career in tech and digital media. It's such an honor to be here today because although I studied in the business school when I was at UW in marketing and management, I was actually a certified fitness instructor for all 4 years of my undergrad, and I taught for the surf and the nap through the UW athletic department. So it's just such a pleasure to be here today, and I continue to be active as an alumni, serving on the WBA board as former chair and vice chair, and currently being on the Entrepreneurship Advisory Alumni Board for the Wine Arts Center. Though we are unable to gather in person, we are thrilled to bring Badgers from all over the world virtually for this event today. Before we begin, just a few notes. First, please acknowledge with me that the Wisconsin Alumni Association and UW-Madison are situated upon traditional territories. The WAA and the university respect the inherent sovereignty of the Ho-Chunk Nation, along with the 11 First Nations of Wisconsin. Today's program will be a panel discussion style followed by a Q&A session. Although we will save questions for the end of the program, please feel free to submit them via the YouTube chat throughout the talk. Our moderator today is Professor Gary Diffee, the chair of the UW-Madison Department of Kinesiology. He leads a team committed to excellence in education and research spanning the vast field of kinesiology. Please welcome Dr. Diffee.
Thank you so much, Rena. It's a pleasure to be here. Thanks so much to the WFAA for the invitation to talk a little bit about some of the great research that's going on in our department right now. I'd like to quickly just introduce our speakers and then bring them back one at a time to talk about their research. So joining us today, we have Dr. Brittany Travers, Dr. Kelli Koltyn, Dr. Lisa Cadmus-Bertram, and Dr. David Bell. So I'm just going to make some introductory remarks, and then we will hear from our distinguished panel of speakers. I do want to say thank you to everyone who's in attendance here. As always, in these unusual times, this would be so much more enjoyable if we could be together and interacting in person. But I'm also aware that this remote presentation is accessible to so many more people than if we had to all try to be in the same room at the same time. So I appreciate all of you tuning in today to hear some of the exciting things that are going on at the university in the area of movement and exercise research. So if I could have my slides up, that would be great. So my job today is just to provide a little bit, and we can go straight to the next slide, a bit of introduction and some context, and then I'll turn you over to our outstanding faculty, and we'll let them talk a little bit about what they're doing. First thing I need to let you know is what kinesiology is. So at the University of Wisconsin, kinesiology is a broad department that incorporates a number of different aspects of the study of human movement, exercise, and occupation. All of this with an emphasis on how these relate to health and wellness. And one of the current trends in the field that you'll hear a lot more about from some of our speakers is that we are definitely broadening our understanding of what constitutes exercise and physical activity. It's becoming clear that we don't all have to go to the gym or train for a 10K in order to get some of the health benefits of movement and exercise. So that means within kinesiology, we end up including a lot of different activities within that broad umbrella of what kinesiology is. It's also clear that we've known for a long time that there are health benefits of exercise and movement. So Sushruta was an ancient Indian physician that lived around 600 BCE. He wrote a treatise on medicine and included a section advocating exercise because it enhanced the growth of limbs and muscles, improved digestion, prevented laziness, reduced senility, while being absolutely conducive to a better preservation of health. Think about it, that's remarkably similar to the things that we might say about exercise in this present day. And William Heberden was an 18th century physician in England. He's the one who coined the term angina pectoris, the chest pain that we associate with heart disease. And he wrote, with respect to the treatment of this complaint, I have little or nothing to advance, although I knew of one who set himself a task of sawing wood for half an hour every day and was nearly cured of subsequent bouts of angina, which really foretells our current understanding of the benefits of thinking broadly about exercise and incorporating activity into our daily lives and occupations. Fast forwarding a couple hundred years, as the field of exercise science, that is the scientific study of exercise and its effects, was just getting started, our department at UW-Madison played a pivotal role in the beginnings of this field. In 1964, Dr. Bruno Balke arrived at the UW and immediately started some groundbreaking work establishing the field of cardiac rehabilitation. Prior to Dr. Balke's work, people that had suffered a heart attack were often treated as invalids for the rest of their life, with the bed rest being really the only prescription. Dr. Balke's work showed that carefully prescribed exercise could actually be an important part of strengthening and healing the heart after a heart attack. Although these ideas seem commonplace now, they were radical ideas in the mid-1960s. During his time at Wisconsin, Dr. Balke was one of the early presidents of the newly formed American College of Sports Medicine and was also the founding editor of the scientific journal Medicine and Science in Sports and Exercise. But of course, you're not here today to hear about our illustrious past, and I'm proud to say that as a department, we are continuing to do cutting-edge research in the field of movement and exercise into the 21st century. I want to just let you know several broad areas of research that are going on in the department, and then I'll let our speakers tell you more about some of those. Of course, we don't have time to hear about all the research done in all of these areas in the department. But one important area of research that's ongoing in the department is to determine what are the mechanisms for all of the health benefits of exercise. How does exercise affect cells and tissues in the body that underlie the improvements in health? And understanding these mechanisms helps us better understand health and disease in general. You can go on to the next, yeah, there we go. So a second area of research is the study of movement disorders, things like Parkinson's, autism, stroke, other disabilities. We want to understand what are the bases for these disorders, and then also understand, can movement and exercise be beneficial in these individuals? So Dr. Brittany Travers is going to talk some about her research in this area. A growing area of research in the field is to try to learn more effective ways to help people increase their activity levels. We've obviously known for a long time that being active is good for you, and I doubt that anyone in the audience is actually surprised by this fact. And yet, most people do not get a healthy amount of activity. So Dr. Kelli Koltyn and Dr. Lisa Cadmus-Bertram are going to talk some about their work in strategies to try to get people to increase their physical activity. And finally, there's a lot that we still don't know about how much exercise is the right amount of exercise, particularly as we think about different individuals and different populations. There are many different types of activity that people can do, and of course, endless variation in how intense we can exercise. So there's a lot of work left to be done on understanding the right amount of exercise. Dr. Koltyn and Dr. Cadmus-Bertram will talk a little bit about this as well in their research populations. And then Dr. Bell will finish us off by talk about an interesting and unique aspect of this subject that he has studied. So without further ado, I'd like to introduce Dr. Brittany Travers. Dr. Travers is a faculty member in our occupational therapy program, which is one of our programs within the Department of Kinesiology. And she's going to talk about some of the work that she's doing in kids with autism spectrum disorder.
Thank you, Gary. Hello, everyone joining us. Thank you so much for being here. So I'm really excited today to share some of our research on how balance exercises may impact autism and the brain. So first off, I'm really excited to talk to you today about one of my favorite topics, neuroplasticity. So neuroplasticity is the idea that the brain is not static, but it is constantly adapting to our experiences. So even you and I just sitting here in front of our computers learning today is actually changing our brains. And there are many nuances to neuroplasticity that I really won't have time to go into today, but I highly recommend David Eagleman's book, Live Wired, on the screen here for those of you who are interested in learning more. But the general idea behind neuroplasticity is that we have repeated experiences. So for example, we teach ourselves to juggle, and then we practice and we practice and we practice. And then these experiences cause the neurons in our brain to activate and to fire together, which then causes new connections among these neurons. And these new connections at the neuronal level over time will rewire the brain at the level of the white matter connections. And these white matter wirings are the superhighways of the brain and allow fast and efficient transmission of information across different brain areas. And we're really fortunate at UW-Madison to have brain imaging methods that allow us to measure white matter connections and how they may change over time. So the last 2 decades of research have shown that motor interventions may be a particularly effective way at changing the brain and bringing about neuroplasticity. So the notion is that our brains need to not only have a mental representation of our body at rest, but we also need to have separate representations for every single motor act that we do. So one for walking, one for running, one for riding on a bike. And when you think about all the things that we do with our bodies and how many body representations our brain needs to learn, it makes sense that our brain might be constantly adapting to this. So the last 2 decades of research and how movement leads to changes in neuroplasticity is really exciting, but it's all been done in non-autistic individuals, so primarily college-age non-autistic individuals. And in our lab that focuses on autism, we wanted to see what could exercise-based interventions do for autistic individuals. So the work in our lab focuses on autistic children and adolescents, and autism is a neurodivergence or neurodevelopmental condition, and it just so happens that April is Autistic Awareness and Acceptance Month, so happy April. The core features of autism, for those of you who may not be as aware of what autism is, are challenges with social communication and the presence of repetitive behaviors and or restricted interests. And these symptoms can present in a number of different ways. So some autistic people will be minimally speaking and will have motor stim behaviors when they're feeling strong emotions. Whereas other autistic people may not have these motor stim behaviors, but may have social communication challenges only when social information or the social environment is really nuanced and complex. So we also know that autistic individuals exhibit differences in motor skills and that balance challenges may be particularly common in autistic individuals. Therefore, a key question that we asked in our lab is, could intensive balance training be helpful for autistic individuals? Specifically, could intensive balance training impact balance, autism symptom severity, and brain wiring in autistic children and adolescents? So we chose to test this question with a spoonful of sugar approach. So next slide, please. Our team designed a video game to facilitate intensive balance training and to provide visual-based biofeedback. So I don't know about you, but if something isn't fun, if movement and exercise isn't fun, I'm unlikely to do it. So we really tried to make this fun for all of our participants. So in this game, participants practiced well-known Tai Chi and yoga poses while standing on a Wii balance board and having their movements tracked with a Microsoft Kinect camera. And we had participants do this training for a period of 6 weeks. So here is a video of me doing this task, and you can see that the participant sees themselves on a TV screen in front of them, and the joint dots are projected onto them. And they step onto the balance board, and they're asked to match their body to the shadow on the screen. And as you can see here, when my body is in the shadow, my joint dots are all turned yellow, and the background comes into play. But if I dip out, you quickly see which joint dots are no longer matching the shadow. So what I want to convey is that this training, even though we did it with a video game and tried to make it as fun as possible, it was very hard work. So participants were standing on one foot at a time for up to 4 minutes. And then they would repeat that 4 minutes over and over for a period of 45 to 60 minutes, 3 times a week for 6 weeks. And we knew that this intervention had to be very intensive if we wanted to see the brain changes that could take place. So in 2 studies now, we've demonstrated that this balance training leads to improved balance both within the game and beyond the game. So within the game, participants on average increase their one-footed balance times by 36 seconds. And this may not seem like a lot, but if you think about tasks where one-footed balance, it might be really important, like walking on ice or stepping into a bathtub or a shower, 36 additional seconds on one foot may be enough time to prevent a future fall. And then outside of the game, balance became more steady, and these balance improvements were above and beyond what was observed in participants who were randomly assigned to our sedentary video game training condition, which served as a control condition in this study. We also found that balance training led to decreased autism symptom severity. Specifically, autistic participants assigned to the balance training started the study with severe autism symptoms that then decreased to moderate symptoms after the training. Whereas you can see the green line up there on the screen was the autistic participants assigned to the sedentary video game control condition, and they did not change in their autism symptom severity over the course of the study. We also found that balance training led to distinct changes in brain wiring, with increased wiring in key sensory motor areas of the brain, including the superior cerebellar peduncle, the sagittal stratum, and the cingulate gyrus. So these brain regions have been linked to both balance training and autism symptom severity in previous research and are known to combine sensory information that our brain's taking in and then also the output of the motor function that we want to be doing. So this was really exciting for us to see. So just as an overview, what we're learning about exercise in our research is that balance exercises may be an effective method for improving balance and decreasing autism symptom severity. And practicing new motor skills may be a highly effective way to rewire the brain and may be able to tell us about how the brain may differ in autistic and non-autistic individuals. So thank you so much for your attention. I would like to thank the participants and their families who gave so much of their time and effort to this research. I'd like to thank my amazing research staff and students, collaborators, and funding agencies that made this work possible.
Thank you, Brittany. Appreciate that overview of your great work. I just want to remind our audience that even though we're saving questions for the end, please, as we go along, if you have some questions, make sure and type those in, and we'll get to those questions. It's when we bring all of our panelists back together at the end. Next, I'd like to introduce Dr. Kelli Koltyn, who's not only a longtime faculty member in the kinesiology department, but is also an alumni of our department, having received her PhD here in 1990. So Kelli's going to tell us about some of her recent work studying movement and exercise in aging individuals.
Thank you, Gary. Hello to everyone out there. I'm happy to be here, and what I'd like to do today is briefly discuss whether or not there are benefits to standing up and moving more throughout the day. Next slide. Most people have heard or read that physical activity is good for them. However, it is difficult to engage in enough physical activity on a sustained basis for health benefits. Well, how much activity do you need for health benefits? In 2008, the U.S. Department of Health and Human Services published physical activity guidelines. Next slide, please. The guidelines indicated that all adults need at least 150 minutes a week of moderate intensity physical activity. And this activity should be aerobic in nature. So for example, riding a bike or walking your dog. In addition, the recommendations indicated that we also need 2 days of muscle strengthening activity. Next slide. In 2018, these physical activity guidelines were updated. And in the updates, they added information on the benefits of physical activity for brain health, physical function, and sleep. They also reaffirmed the previous recommendations of moderate intensity aerobic activity at 150 minutes per week for health benefits. However, over the 10 years, the percentage of the population who was participating in these recommended levels of physical activity remained low. Next slide. Further, time spent in sedentary activities had increased across the 10 years. So a new recommendation was added, and that recommendation indicated that we should move more and sit less. Next slide. So there's an increased interest in focusing on sedentary behavior. Sedentary behavior involves participation in activities that do not substantially increase energy expenditure above resting levels. So, for example, sitting watching TV or lying on the couch and searching the web. The problem is these activities tend to take up most of our days, and estimates indicate that many people spend anywhere between 60 to 70% of their day in sedentary activities. There are health consequences associated with too much sitting. Some of the health consequences that have been identified in the research that's been conducted include too much sitting is associated with premature mortality or early death. It's also associated with some cancers, diabetes and metabolic health, as well as obesity and weight gain. And these negative consequences of too much sitting can also occur in individuals who are physically active, especially if they're sitting most of the rest of the day. So we developed a community-based intervention to reduce sedentary behavior, and we call it the Stand Up and Move More intervention. We pilot tested the intervention in Rock County. This work was funded by the Greater Wisconsin Agency on Aging Resources, and we found the intervention to be safe, effective, and feasible to implement in community settings. So the next step was to conduct a larger study, and we received funding from the National Institutes of Health to conduct a randomized controlled trial to examine whether our Stand Up and Move More intervention could be translated by state aging units to older adults in underserved communities. The intervention, the Stand Up and Move More intervention, was offered as a small group workshop in rural communities in Rock, Iowa, and Vilas counties in Wisconsin, and in an African American community in Dane County. The intervention consisted of sessions once a week for 4 weeks, with a refresher session at 8 weeks. It was delivered by health promotion coordinators from state aging units, and we completed assessments of sedentary behavior, physical function, and health-related quality of life before and after the workshop. We screened 74 adults over the age of 55 years for eligibility. 56 individuals with a mean age of 74 years participated in the study, and they were randomly assigned to either the Stand Up and Move More group or a waitlist control group. Individuals in the Stand Up and Move More group strategized on ways they could decrease safely their sedentary behavior within their home environment, and then tried out different strategies across the 4 weeks. The strategies that were used most often to reduce sedentary behavior included standing up during TV commercials, spreading household chores out across the day, physical reminders around the house, for example, setting a timer or putting a note on your mirror in the bathroom to stand up and move more, and then standing up during activities you used to do sitting down, for example, talking on the phone, reading, quilting, working on puzzles, and while paying bills. So did these strategies work? And the answer is yes. Sedentary behavior decreased significantly, on average by 68 minutes a day, so for over an hour, and there were significant improvements in physical function. Specifically, there were improvements in balance, walking mobility, and getting up from a chair. In addition, pain was found to be significantly lower following participation in the Stand Up and Move More workshop. There were significant improvements in general health and vitality, and participants who completed the workshop reported significantly fewer problems performing work or daily activities due to physical or emotional health. So these results indicate that there were benefits from standing up and moving more throughout the day, particularly for physical function and quality of life. And I'd like to take this a step further and encourage everyone to stand up and move more. And while you're up, why not add in a little physical activity? Because you can get even more benefits if you include physical activity into your life. Many people to acknowledge and thank. This was a great partnership and a great team. I really enjoyed conducting this research. But I do want to do a special shout out to our community partners, Brittany Mainwaring and Valerie Hiltbrandt from Iowa County, Joyce Lubin and Lisa Lucas from Rock County, Amy Ryan and Sue Richmond from Vilas County, and Pam Bracey and Fabu Carter, who's affiliated with the UW South Madison Partnership Office. Thank you to everyone, especially the participants. Thank you.
Thank you, Kelly. That was incredible to hear about the benefits of standing up and moving more. I'd like to bring on our next speaker, Dr. Lisa Cadmus-Bertram, who's a faculty member in the kinesiology department. She's going to talk about her work in another specific group, that is cancer survivors, and looking at the role of exercise in the health of cancer survivors. Lisa.
Thank you, Gary. My research program focuses on the epidemiology of physical activity and chronic disease with, like Gary said, a special focus on cancer. Today, I'm going to share a little bit about why this topic is so important and give an example of one of my projects. Next slide. In healthcare and public health, we talk about something called the cancer care continuum. Because cancers often develop over the long term, we're very interested in prevention, which includes things like getting the HPV vaccine, not smoking, avoiding heavy alcohol consumption, and so on. Early detection is also very important, and that includes things like mammography, colonoscopy, and pap smears. Once an individual is diagnosed and treated for cancer, at that point they're considered a cancer survivor for the rest of their life, whether that's 1 year or 70 years. And of course, some people do experience a recurrence, so they may go through that treatment cycle more than one time. Next slide. We now know that physical activity is really important in multiple stages of the cancer care continuum. So people who are highly active have about a 10 to 25% lower risk of developing 13 different types of cancer, including some of the most common ones like breast cancer, lung cancer, and colorectal cancer. Once a cancer is diagnosed, physical activity can help manage treatment side effects like fatigue, and it can also help prevent muscle loss and weight gain. So sometimes when people think about cancer and weight, they actually think about weight loss, but that's something that happens more often in advanced disease. A lot of people actually gain weight and body fat during their cancer treatment process. Multiple researchers have designed physical activity programs that are specifically to help support people who are going through chemotherapy and radiation. And there's now some programs that are actually what we call prehab programs. So they're exercise programs designed to prepare your body to withstand successfully the stresses of cancer treatment. Another emerging area that's pretty cool is the study of whether there are actually physiologic mechanisms by which exercise may help some cancer treatments to work better. Then once treatment's completed, we have lots and lots of data about the benefits of physical activity on outcomes after cancer. Expert panels have assessed and reviewed these studies and determined that there's strong evidence that physical activity reduces anxiety, depression, and fatigue. It promotes quality of life and physical functioning, and there's moderate evidence to suggest that it also improves sleep and promotes bone health. So exercise is very beneficial after cancer, and it's also been shown to be generally safe. For that reason, the physical activity guidelines put forth for cancer survivors are just the same as those that Kelli showed you for the general population. 150 minutes per week of moderate intensity exercise plus strength training twice a week. Of course, working up to that goal isn't going to be realistic for everyone. For example, people who have a lot of functional limitations due to advanced disease. But with physical activity, we know that every little bit counts, so we encourage people to do whatever they can. So Gary gave you a great summary earlier of Bruno Balke's work pioneering cardiac rehab here in the 1960s. And today, if you have a cardiac event, you'll be referred right away to cardiac rehab, which will help you to exercise in a way that will be safe and effective for you. And it will also provide you with education around healthy eating and stress reduction. Cardiac rehab is available all across the country. It's covered by insurance. However, if you're one of the 40% of people who will someday develop cancer during their lifetime, there's going to be no specific approach to supporting your recovery. So you might be referred to a session with a nutritionist or to physical therapy to help with functional problems caused by your treatment, but that's typically about it. So you would probably be given paperwork that includes a recommendation to exercise. But obviously, for most people, that's not going to be effective unless it's backed up with some type of meaningful support. And that's because changing habits around exercise and eating is really very hard. It is simple, it's not complicated, but it's not easy. Some people will be successful in doing it on their own, but many more are going to need some support. So why is there not a better structure in place to help patients get access to exercise-based cancer rehab? Well, there's lots of people working on this, and I've seen much more progress just over the past 5 years than in the whole 10 years prior. So I'm really hopeful that we'll get to a point where comprehensive rehab is part of the standard approach to cancer care. But right now, these are what I see as the main barriers standing in the way. First, patients are saying that they want guidance about exercise from their oncology care team. But the truth is that the providers are super overloaded. So when they're with a patient, they cover the most critical things like assessing side effects and reviewing the treatment plan. But they really don't have time to discuss a lot of extras in depth, things like a healthy lifestyle. And second, there's often no specific programs to which patients can be referred. So most health systems don't have an exercise program for cancer survivorship. Like, it just doesn't exist. And while there are some really great community-based programs, those aren't available everywhere either. Then third, our providers, of course, are trained to be experts in medicine, not in kinesiology or behavioral science. So they're not necessarily going to be familiar with how to write a good exercise prescription or how to tailor it to a patient's specific needs or how to motivate somebody the way that a health coach can. And then finally, and this is a big underlying factor, exercise promotion is not part of the insurance reimbursement structure. And that's a huge limitation in terms of what can be offered on a broad scale to patients, even if the program would improve our patients' health. I've been working with exercise programs for cancer survivors for about 17 years now, and one of the areas that excites me most right now is trying to figure out some workarounds to meet the needs of cancer survivors until there's a better availability of programs offered directly through clinical care. So one example is our current trial funded by the National Institutes of Health. It's called the My Activity Study. In this project, we're enrolling 320 women who've been treated for either breast cancer or endometrial cancer. And we enroll patients both here at UW Health and also at Northwestern University in Chicago. The goal of our project is to use technology to circumvent some of the barriers to physical activity promotion. Basically, we want to create a scalable exercise program that exists mostly outside of clinical care, but it feels to the patient like it's part of their healthcare. To do this, we provide a Fitbit tracker to each of the participants. They use it to monitor their activity and to work towards a progression of weekly goals. Their Fitbits are all linked to their Epic electronic medical record through the patient-facing side, which is called the patient portal. Here at Wisconsin, it's called MyChart. Then we have a package of custom features that we've built into the electronic medical records at both of our two sites. So first, patients on the study receive a weekly message through the My Chart portal that provides feedback about their physical activity level, health tips, and a reminder about their goal for the upcoming week. And these messages are personalized based on what stage of the program the person's in and how their past week's activity compared to the goal for that week. Then at the same time, the physical activity data are also available to the oncologist and other clinicians on the patient's care team. So those people can view the information in the health record at any time. But because we know that clinicians might not have time to review those data in detail or the expertise to interpret them, the system will send them a message in the morning on the day of an appointment with that patient, reminding them, hey, your patient is part of my activity study. This is how far into the program your patient is. This is how they're doing with their goals. This is what their goal is going to be for the upcoming week. And here's a few options for some personalized, quick talking points that you can use to encourage and motivate your patient. So right now, we're almost halfway accrued with this trial, and we'll be finishing our data collection in 2023. And then if our program works, our next step is to seek funding to refine and improve it, and also to test it in some broader groups of patients. I hope that gives you a sense of some of the work we do, and I'd like to thank our participants and my collaborators on this project, which includes Siobhan Phillips at Northwestern. She's my co-principal investigator, and our co-investigators here at Wisconsin, oncologists Amy Tabarwick and Ryan Spencer, Mary Sesto, and our biostatistician, Ron Kenyon. Thank you.
Thank you, Lisa. I'd like to bring up our next speaker, Dr. David Bell. Dave's a faculty member in our athletic training program within the kinesiology department here. And Dr. Bell is going to talk about a different aspect of this idea of how much exercise is the right amount of exercise in a particular population of youth athletes. David, take it away.
Thank you, Gary, and thank you to everyone who's attending this session today. I certainly appreciate it. You know, another title for this talk might be, you know, what parents and coaches and athletes need to know about sports specialization. You know, my background is as an athletic trainer, and so, you know, I've provided medical care to athletic teams for many years, and so I've seen way too many injuries happen in kids, and I'm a little worried about what's happening in youth sports these days. So next slide. I don't have any disclosures. I'm going to start by talking to you about a point on a graph. I know that might sound a little not exciting, but hang with me here. So over on the left side of your graph, over at 1974, that's the one I want to talk about. Each of these represent a person, and that particular one represents Tommy John. So Tommy John was a professional baseball pitcher, you know, back in the 70s. And he injured a ligament in his elbow called the ulnar collateral ligament. Well, Dr. Job, Frank Job, pioneered a surgery to help fix that particular condition, and it salvaged his career, and he was able to go on and pitch for a little while longer. This reconstructive surgery is now called Tommy John surgery. And what you can see on this graph here is this graph represents the number of Tommy John surgeries that have occurred in Major League Baseball from 1974 to 2014. And what you can see is around the mid-90s, we see this huge spike in the number of Tommy John surgeries that are being performed. The only problem is that this just doesn't happen in the major leagues. It also happens in kids and youth sports. So this graph represents the number of UCL surgeries that are occurring at the Andrews Sports Medicine Clinic in Pensacola, Florida. This is Jimmy Andrews, Dr. Andrews, who is a very well-known orthopedic surgeon. And so you can see here, probably the most interesting one is 2015 is where these peak, that 60% of the surgeries that they were performing were in kids that were less than 18 years of age, right? So, and this isn't just occurring for just UCL surgeries. We're seeing this in a lot of different injuries that are occurring in youth sports. We're seeing an increase in overuse injuries and an increase in a lot of other injuries and conditions that are associated with sports. So we think that this is partially caused by this idea of sports specialization. The definition's there, so you can read that, but this is the idea of playing a single sport year-round and focusing on that sport rather intensely. And so, next slide, please. And you can't get around sports without talking about the risks of sport and also the benefits of sports. The benefits of sports are certainly huge, right? There's so many positive aspects that we want to consider, being part of a team, self-esteem. Sometimes there's, good grades are a part of all those things that are mixed in with sports. The benefits are also that some people make a lot of money, right? Some people get a college scholarship or a contract, a professional contract. But there are risks to playing sports as well. We've talked a little bit about injury, but injury is definitely something that a lot of people are concerned about because it has long-term consequences that can follow you throughout your lifespan and affect your physical activity as well as your quality of life. You can also get burned out and not want to participate in sports anymore. And there's a lot of time and money that's involved with youth sports. And in fact, that's one of the things that we hear a lot of parents from the pandemic recently. They were like, you know what? Gosh, I kind of actually liked being home every weekend instead of being on these travel teams with my kid and traveling 6 or 7 hours and staying in hotel rooms every night and every weekend. Next slide, please. So let's talk a little bit more about the youth sports, what's happening in youth sports these days. The number one reason why kids play sports is because it's fun. The number one reasons why kids stop playing sports is because it's not fun anymore. And there's a lot of reasons why what's fun to kids, right? Sometimes it's because their friends play, and sometimes it's because they're just really enjoying getting good at something and getting better at something. But there's also some really alarming numbers. And we care about sports because sports is a subset of physical activity. And you've heard of all the wonderful things that we need to have kids and young adults and adults do when it comes to physical activity across their lifespan. The bad thing is that about 70% of kids are going to drop out of sport by the age of 13. Girls drop out of sport about 6 times the rate that boys do. And you also hear kids that just say, you know what, I'm just burned out. I couldn't do it anymore. It wasn't fun anymore. So why are kids doing this? Well, I think there's probably 3 big reasons why kids might be doing this. Number one is skill development. So the idea is that if I start learning a certain skill and practicing, I'm going to get better at that skill. And I'm going to kind of move ahead of the person next to me. And I'm going to be more likely to make that club travel team. I'm going to be more likely to make my high school team. That means I'm going to be more likely to get a college scholarship, which is number 2, and maybe get a professional contract. Unfortunately, these are really, really rare, right? Professional or college scholarships and professional contracts that's kind of like winning the lottery. Only about 2% of college football players and less than 0.1% of high school football players actually go on to play professionally. So the numbers are pretty bad. The return on investment is tough. And that's especially considering that we talk to parents who spend $10,000 per year per kid on the youth sport experience. The other reason that more and more kids are specializing nowadays is that people have figured out how to make money off of kids playing sports. And that's what number 3 is. We were lucky enough to be featured in this Time magazine article over here from 2017. They estimated that the youth sport industry is roughly around $15 billion. And that I've seen estimates that that's probably up to $25 billion now. And so a lot of these teams, they travel leagues, they talk about coaching, right? But they also develop policies that are good for their bottom line, but not necessarily good for the health and well-being of the kid. For example, one of these might be like, hey, if you don't play baseball with us in the fall, we're not going to allow you to play baseball with us in the spring. And so it's really this up or out kind of mentality because there'll always be someone there to kind of take your place. So what have we learned here at Wisconsin? We've probably been doing research on sports specialization for about 7 years now. And when we started this, we thought that this might be a pretty narrow issue and that it might only impact, maybe 5 or 6% of kids. But what we've actually learned is that anywhere from like 14 to 35% of kids are actually classified as highly specialized. So this is impacting a lot of people, a lot more people than we thought. It used to be that specialization used to be reserved for individual sports like figure skating, tennis, stuff like that. But now it's really it's in basically every sport that you can imagine and team sports as well. We also know that girls are more likely to be classified as highly specialized compared to boys. And we know that if you attend a large school, or live in a suburban or an urban area, you're going to be more likely to be classified as highly specialized than kids who attend smaller schools or attend or live in rural areas. So these are just some of the estimates from our research of what percentage of kids who we survey are classified as highly specialized, right? So you can see in the top right there, 54% of volleyball players, youth volleyball players in this particular study were classified as highly specialized, which was pretty crazy to us. 43% of hockey athletes, 51% of lacrosse players, 33% of basketball athletes. So those numbers were really, really high. We've talked a little bit about injury, but we know from our work here at UW, we've been really able to link specialization and injury. When we first started this, it's something that we always heard. People would say like, well, don't we already know that? But there actually wasn't a whole lot of literature, barely any, basically, that was able to link specialization and injury risk. Now we have a bunch of studies that have been able to show that this relationship does exist. And if you're a highly specialized athlete, you're going to be 2 to 5 times more likely to suffer some sort of injury. So how much does this cost? Well, it costs a lot. We've estimated that the United States will spend somewhere around $5 billion on sport specialization related injury. And that's just in the direct costs. That doesn't include, for example, like the indirect cost where mom and dad have to miss work to take their athlete to go to the doctors or to different appointments. So last year, a couple of years ago, actually, the NATA, the National Athletic Trainers Association, asked us to develop some recommendations based off sport specialization. These are not all our recommendations, but they're kind of a combination of the ones that we think are particularly useful. Next slide, please. So we'll start on the bottom left here where it says no more than 8 months per year. Our recommendation is that youth athletes only play a single sport about 8 months per year, and that they have 3 or 4 months away from that sport to allow their muscles to rest, to allow their body to recover during that time period. The next one up there where you see the number 32, 1 team at a time, we recommend that athletes participate in 1 organized sport per season. We're hearing now a lot of athletes who will be at their high school soccer practice and then immediately leave and go to their club soccer game, right? So that's just a lot of soccer that's occurring in one day. Or even something different, right? They'll have their high school soccer game or high school soccer practice on one day. The coach has given them the next day off and they'll be at their club basketball practice, for example. So they're really not giving their body any time to rest and recover. Another recommendation there is to delay specializing as long as possible. And go ahead. And we'll stay in the top right and we'll talk about no more hours per week than your age and years. So for this particular recommendation, it would be like, okay, I have a daughter that's 13 years old. How many hours per week should she be participating in sport? And the recommendation is probably around 13 is probably a good starting point. This is actually one of our favorite screening questions for a lot of our physicians here at UW. A kid comes in, they have a stress fracture, and the parent and the physician asks the parent, how many hours per week is your daughter playing sports? And they'll start on one hand, counting the hours, right? And they start on 2 hands, and then they go to 3 hands, and then you can see this kind of concerned look get on their face, right? And then they start going in their 4th hand, and then you can see what's happening to that parent as they realize, oh my gosh, my kid just plays a lot of sports. They do a lot of different physical activity. So that's our recommendation for that one. 2 days of rest per week. Our college athletes get 1 day off per week. So we really feel that kids that are younger than that should be, maybe if you're in high school, it's probably might be okay to do 1 day per week. But lower than that, you should really be having 2 days of rest per week. And then finally, recovery time, right? Spend time away from your sport at the end of the season. Give yourself some time to recharge your batteries. I really like to kind of point out volleyball in Wisconsin. Club tryouts in Wisconsin for Wisconsin volleyball occur the week after the state championship occurs for high school volleyball, right? So a lot of those kids are going to be rolling from those state championship tournament straight into club play, and they really don't have any time to rest and recharge. I'll leave you with just something that I think is kind of perfect for this day and age, just to prepare your child for the path and not the path for your child. this research, there's a lot of people that I would love to be able to thank, have a great group here at Wisconsin. And thank you to everyone who was able to attend today. Thanks.
Thanks, Dave. I'd like to bring all of our panelists back now to answer some of the great questions that people have been typing into the chat. Would encourage you to please continue to type questions in as we're going to start trying to tackle some of these. We have a few minutes to go through some of these questions, so would love to see what other questions you might have. First question maybe is for Lisa and Kelli to tackle. There's a lot of interest about a little bit more detail about the 150 minutes of exercise. Can you give us some examples of what moderate exercise would be that fits that 150-minute criteria, and then any other details about how that 150 minutes should be structured?
Lisa, do you want to start or should I?
Sure, maybe I can talk about intensity and you can talk about structure.
Sure.
So when we think about the intensity of physical activity and what moderate intensity means, it can be different for different people. So if you're a 20-year-old athlete, walking at a certain pace might be light intensity for you, but for your grandparent, it might be a moderate or even vigorous intensity. So moderate intensity is probably something that gets your breathing faster, gets your heartbeat faster, but typically you could still maintain a conversation. So sometimes we tell participants that a moderate activity is an activity where you could talk but not sing. If you can't talk or sing, then it's probably more of a vigorous activity. So examples could be like a brisk walk, cycling, swimming, a lot of different lifestyle activities, just depending on how the perceived intensity is for you.
And the recommendations indicate that you can accumulate 150 minutes across the week. And so just to give you one example, would be performing 30 minutes a day for 5 days. That would accumulate into 150 minutes. But you could do it however works best for your lifestyle, as long as you're getting at least 150 minutes of moderate intensity aerobic activity. That's what's been recommended as far as health benefits. In addition, neither Lisa nor I talked about this, but if you prefer vigorous intensity physical activity, like going for a run, then you can cut down on the amount of time per week. The recommendation for vigorous physical activity is 75 minutes. But again, I think for most of the population, moderate intensity physical activity would be performed most often.
Thanks, Lisa and Kelli. Brittany, there's a question for you on how long after the intervention do you see some of these improvements in your subjects?
Yeah, we haven't been able to test that yet, so it's an open question. But that is something that we look forward to looking at in future research.
Thanks, Brittany. Dave, there was a specific question for you about how are you sharing these recommendations with local community groups to get this information out to the public?
Yeah, that's a great question. I mean, the tough thing is with youth sports is that it has to be kind of this continual way to disseminate this information, because there's always kind of a new crop of kids that are coming in and another crop that are going out. And more important, and just as importantly, there's a new group of parents, and with youth coaches, and with coaches, sometimes there's a whole new set of youth coaches that are coming. So we've been, we certainly try. I go talk to a lot of different community groups. I'm always happy to do that. A lot of this information can be found on our website. With the NATA, they did a nice blast where they reached out to the New York Times, and we had an article there, and so they're, it's never as good as it should be, right? Admittedly, but we definitely always need better strategies to try to disseminate some of this research, because living in a web page is one thing, but actually getting out into the people that actually need it, we realize that's where the critical game-changing information can come.
Just to follow up, Dave, someone wants to know about, just with the unique situation of truncated seasons with the pandemic, do you have any advice based on your work for multi-sport athletes that are trying to figure out how to change things now with this new situation?
Yeah, I think it's actually really important that parents are going to advocate for their kids and maybe need to say no to some of these things, right? I think everybody has good intentions, or a lot of people have good intentions when it comes to youth sports. And I think a lot of this information is just going to be compressed. I still think the recommendations hold, right? Like we still need to make sure that I think the hours per week one is going to be the key one. I mean, that's probably the number one question that we actually get. I got a phone call the other day, and it was Bob from Baltimore, and he had heard about our research, and he was like, "Hey, I've got a question for you." And he said, "I heard that sports specialization is bad. So my daughter plays lacrosse, and so I've signed her up for soccer as well. Is that okay?" And I said, "Well, maybe not. Again, if you're going from soccer and you're going from lacrosse and you're going to soccer, right? Those are two sports that are doing very similar things, right? They're kind of putting a lot of stress on the lower extremity. They're both running-based sports. We don't have a good sense about like what a good combination of sports would be. It would kind of make more sense, excuse me, if probably a good thing about the pandemic is so I'm not coughing on people, right? Doing this is maybe it would be better if we had if you could put them in like swimming, right? For example, maybe an upper extremity sport. Or if they really wanted to learn some transfer skills, Kobe Bryant talked about this a lot, right? He said, "I love to play soccer because I learned about how teams moved, how to rebound after a shot, how a ball would interact with things." So there's a lot of transfer that can happen with a lot of those different skills. So, again, paying really close attention to that. How many hours per week is your kid participating in sport? And that includes dance. That might include maybe includes PE, depends on how much they're doing it, in high school, for example. But just pay particularly close attention to that one and make sure that your kids are getting breaks. And that might mean that you have to say no. And that's a hard thing to do. And I totally get it. It's a really hard thing to do.
Thanks, Dave. There's been several questions about how to access some of the information in more detail that several of you have talked about, or how to get connected to some of these programs. And some of these answers have been answered in the chat. But there's one for you particularly, Brittany, wondering if people can access this balance training video game for their kids. I wonder if you'd speak to that.
Yeah, I'd be happy to talk more about it. The major barrier right now, so it's programmed for a Windows machine, and it connects a Kinect camera and a Wii balance board with specialized software. So it's not the most intuitive game. That's something that we're working on, is really trying to make it user-friendly so that it can be used better in the future. But if that's something that you feel like you'd be willing to problem solve on it, we want this game to be used as much as possible. So I'm happy to share that.
Do either Lisa or Kelli, do you want to talk just briefly about any advice of people getting connected to the programs that you talked about?
Sure. So anyone who's interested in enrolling in our My Activity study, we're going to be continuing to accrue patients for several months at least. And I saw that Melissa put our email address in the comments section, so you may have to scroll up a little bit. It came in at about 12:46, but our email address is myactivity@uwcarbone.wisc.edu. So if you have been diagnosed with breast or endometrial cancer within the past 5 years, and you're already a patient at UW Health or at Northwestern, we'd love to hear from you.
Thanks, Lisa.
Oh, sorry.
No, go ahead.
And for the Stand Up and Move More workshop, we are currently testing online workshops. We've got 4 going right now, and we are recruiting for another one in April and 2 in May. So if you are actually interested in participating in an online Stand Up and Move More workshop, please email me. And there was a question about activities that people did, like, for example, standing up during television commercials. I did make a table summarizing all of the different things that people did to stand up and move more. One of them that I really liked was a woman who, when she was cooking, she was standing, but she also wanted to add in activity. So she took her spice rack, which was next to the stove, put it all the way on the other side of the room on the wall. So she would have to walk back and forth to get her spices when she was cooking. And so there's a lot of different activities. The main thing is you have to do what's safe and doable within your home environment. But if anybody wants that table, you can email me. It's kelly.koltyn@wisc.edu.
Thanks, Kelly. All right, we have a great question to end on here that I'm going to ask everybody to weigh in on a little bit, either generally or as it relates to your specific topics that you talked about. So the question is, if everyone makes one change to improve their health, what would you recommend it be? And I'm going to take a stab at this to start us off. I think there's a great way of thinking about this that's out there that as people really wonder what's the best exercise to do. The best exercise to do is one that you will do. So many people are trying to make themselves do something that they don't actually enjoy doing. And that's really a recipe for failure. So I really recommend find something that involves activity and movement that you like doing and do that. And that will get you a long way to where you need to be. So.
And I bet you can guess what I'm going to say. Stand up and move more, and while you're out, do some type of physical activity.
The recommendation I would have is to focus on just the first step of starting your physical activity. And this is a tip that I got from another mom when I was postpartum after my first baby, and I was talking about how to get back into running and how to get motivated. And she said after she had her baby that she would just tell herself that she was going to go outside and run for 5 minutes. And this is a woman who had run marathons routinely before, but she found that just putting on your shoes and getting out the door is half the battle. And maybe you only do exercise, walk or bike or whatever it is for 5 minutes. And that's great because that's a lot more beneficial than having done nothing. And half the time, once you get through those 5 minutes, you're actually going to feel totally fine to do 10 or 15 or whatever other amount. So just forcing yourself to do that very tiny initial amount to get through that first barrier.
And I guess I'll make it more personal, right? I'm going to go play some golf to make myself more physically active, go walk on the golf course. Because it's just not about the physical aspect, it's about the mental health as well. And I think that's one of the things we've learned also during the pandemic is that, especially in kids, right? Like, and a lot of everyone, but definitely in kids as well, that, this is a mental release for a lot of people, and it makes them happy and it makes them feel good. And there are so many positive aspects to that let's not forget the mental health part of it as well.
My recommendation would be to try something new, try a new movement, change it up, get those new brain wirings working, and practice.
All right, I think with that we will we'll close. I want to personally thank all of our presenters here on the excellent work that they're doing and the excellent job that they did in presenting. And I'm going to turn all of you back to Rena now.
Thank you, Dr. Diffee. And on behalf of the Wisconsin Alumni Association, thank you to Dr. Diffee, Dr. Bell, Dr. Cadmus-Bertram, Dr. Koltyn, and Dr. Travers for this wonderful presentation and such a helpful and insightful discussion today. And thank you to all of our viewers for joining us and asking such wonderful questions on Wisconsin. And stay safe and stay healthy and get that exercise in. Thank you.